We're trying to bring the diagnostics outside of the labs, away from people who are trained with white coats, and bring diagnostics to the masses. Imagine putting these mobile kiosk centers and self-care healthcare desks where people walk in. Imagine a phone booth kind of thing. You walk in there and a doctor from the screen is talking to you, and it could be a real doctor, it could be an AI doctor. The patient walks in and deposits their urine sample or saliva sample or even blood sample, and that's it. The rest of the testing and automation is done by the machine, and the results, whether you have some infection, whether it's viral or bacteria dependent, results are available within of minutes. And I see in the future a 3D printed medication could be done. It's a far-fetched idea, but I think this kind of technology at home in the future could enable medication 3D printed at your home or delivered very quickly that is precisely done based on your DNA.
Like it's wild that right now there is not this machine already existing, no, and that you are actually creating it and creating it in a way that it's not only as accurate as a lab, but also it's cheap.
For people like us who are passionate to just give up and not do it just because 24 companies that came before us failed doesn't mean 25th will not succeed.
Is that this device, you don't only use it in humans, but you actually could test if the meat is correct, if it has any infection.
I really do think that there's the stigma around point of care will go, and it has to go because it has some serious implications for society. And it has real implications on people's lives.
Okay, so thank you so much for joining me again. So the other week we had a chat with Manny because right now what's happening in healthcare is really exciting. You know, we are moving from a sick care to a more preventative care, and he is part of this movement. He has founded this company here in Silicon Valley to prevent diseases. We need things like diagnostics and point of care. So yeah, tell us a little bit what you do and the company that you've created.
Sure. Thank you, Mark. Thank you for this opportunity. We are a startup company. The name of the company is Senstek Diagnostics. We're located in Oakland, California in US. We're an eclectic group of scientists, doctors, engineers who came together to solve a problem that seems to be not doable by the people who are in this industry and the companies that are involved in healthcare specifically. So we came together to develop a sensor technology and eventually a diagnostic device that's built on that sensor technology that could revolutionize the way healthcare is administered and how diagnostics plays into it. So we're trying to bring the diagnostics outside of the labs, away from people who are trained with white coats, and bring diagnostics to the masses. Eventually, in the long run, I see untrained people should be able to operate these kind of devices and detect themselves if they've got any infectious disease or virus and whatnot. And obviously in consultation with the doctors, telehealth doctors, and eventually doctor bots, right? With all this AI activity that's taking place. So that's our goal. We fit into that diagnostics area. We think there is a disruption needed. So we're hoping to be the agent of change in that space.
That's really interesting. And you've mentioned that diagnostic right now happens a lot into labs, no? So can you elaborate a little bit why is there a problem right now with all these diagnostics happening in labs, and why is it important to have more diagnostics in the world?
Sure. So the current paradigm for diagnostics is still very lab bound. You feel sick, you have some symptoms, and you go to your doctor or hospital. You have to go to the lab to give your sample, urine, saliva, blood, stool, whatever. Again, trained people are involved there. Sample gets taken, then it's shipped to the the central processing lab somewhere. Over there, they use these big machines. Sometimes they fill the entire room. And they have to do this in batch processing to keep the costs down. And then a few days later, you get the results. That's the current paradigm. Again, that's an example of human beings. Same thing applies to environmental monitoring, whether you're monitoring your agriculture, food, water, animal husbandry, for example. Again, the same routine applies where this whole sample taking to result is very costly because of the steps involved and the people involved and the expertise needed. So that's how diagnostics are done today. We think that there is a need for point of care device in the hands of civilians eventually. And not just civilians, but when I think about point of care device in the long run, imagine putting these mobile kiosk centers and self-care healthcare desks where people walk in. Imagine a phone booth kind of thing. You walk in there and a doctor from the screen is talking to you, and it could be a real doctor, it could be an AI doctor, like I said. And there are people and companies that are working on these kind of concepts. And so idea of those kind of products is to allow the patient to walk in, interact with the doctor, and there are machineries in there that are easy to operate. Things like temperature monitoring, oxygen monitoring, blood pressure, glucose monitoring. Those are easy to do, right? We trust patients. The technology is good enough that we trust patients to be able to routinely and accurately operate those easy to operate machines. What we're doing is with our device, we see that our diagnostic device, where a patient walks in and deposits their urine sample or saliva sample or even blood sample, and that's it. The rest of the testing and automation is done by the machine. And the results, whether you have some infection, whether it's viral or bacteria dependent, results are available within. And then after that, whatever the next step is in terms of cure or medication and prescriptions, those could be done. So the whole loop could be closed within a matter of tens of minutes. So we think there is a room for us to play there, because it will alleviate a lot of pain and suffering, and eventually the cost, the way things are done today. It adds to cost. As we all know, in the West, our healthcare systems are not working optimally. I don't want to say it's broken, but it's close to being, some people believe, broken. The costs are too high, people are still sick, infections are still spreading, and worse yet, some of these pathogens, because the way things are done today, where doctor, out of necessity, has to give broad spectrum antibiotics for infections that are not even bacteria based. So if infection is caused by a virus, then the net result of that is now we're seeing some pathogens that are resistant to antibiotics. So that kind of antibiotic resistance for society is a dangerous thing. We have all learned, hopefully, some lessons from COVID-19, the pandemic that we just saw a couple of years ago. That's a wake-up call. So, so what our solution does is to be more precise and allow doctors to be more precise about when they write prescriptions. It's a tool for them. If it's a viral-based infection, then there's no need for antibiotics, for example. So that's where we think we can make a difference, that within minutes, if results are available, then doctors can be more precise about how they treat infections. So that's where we think our point of care device eventually will fit into.
That's really good. So you've mentioned that the current system is much more expensive. It takes a lot of time. As a result, it involves lots of people to test. And then as a result, lots of patients don't do it, and not everyone has access to this. So this has a problem with access. And your solution, less time, cheaper, everyone can do it. It democratizes healthcare. So it's really good. In terms of now testing, people have maybe in mind only infections like COVID or flu, but I think that this is much wider. Can you also elaborate, like, where do you see this going?
Absolutely. I think If you're a fan of science fiction, some of these ideas that are common practice today were a part of a science fiction, right? At some point in Star Wars, etc. The cell phone technology and wearables and all these things were conceived in science fictions and novels. I'm a big fan of those. So the way I see in the long run, this kind of technology where you can do what we're talking about here is essentially the ability to do any kind of DNA, RNA detection. And that applies to not just infectious diseases, but also eventually, if you fast forward enough, eventually into medication that is precisely 3D printed for you based on your DNA, RNA. Just the way we're 3D printing things now in our homes. I see in the future a 3D printed medication could be done. It's a far-fetched idea, but I think this kind of technology at home in the future could enable medications 3D printed at your home or delivered very quickly that is precisely done based on your DNA. So this kind of a point of care device, and when I say point of care, again, this is a very small form factor, right? That's what we're talking here. So cassette, in this case, we can do up to 16 molecular diagnostic tests. So essentially, we could do up to 16 DNA, RNA recognition, whether it's bacteria, virus, or something else. It could be done in this form factor. And we're trying to make it simple enough and yet accurate enough, right? It has to be accurate. So our goal is to miniaturize it, make it easy, but also the accuracy of this should match how things are done today in the lab using hundreds of thousands of dollars worth of machines and trained staffs and PhD. Miniaturize it, low cost it, that you have the ability to do this and the results are as good as lab grade. The beauty of that is, when I talk to you about AI eventually, I don't think AI doctors are going to replace the real doctors today. I see more of it as a complementary tool for doctors today. The way things are done today, you go into a doctor and the way things are diagnostics are done, doctors are busy in doing these tactical things because they are time consuming, and so are the lab people, etc. Imagine if you have a point of care device that's so easy to operate and within minutes you get results. Either doctors can see more patients within the same time frame, or they can use that 45-minute window to bond more with the patient and have more meaningful conversations. In my grandparents' generations, patients were not as cynical as they are today about doctors. So today, there is the cynicism that doctors are, some people at least anyway, believe that doctors are only, they're apathetic, they are more mechanical about giving prescription drugs, and there's hardly any conversation that bonds and gets to build that trust and essentially the power to heal. That kind of relationship existed a few decades ago and it's gone. So if you have a technology like this that shortens the diagnostics and allows more time for doctor to know the patient and do these things, I think it's a wonderful thing. But the requirement is that this easy to use device has to be lab grade accurate, right? And doesn't require any human interpretation, because we digitize whatever we measure on our sensor, it's creating a digital data as opposed to analog data. What I mean by that is when things are done today, people are involved and there are test tubes and then they look at the color change and there is a human element involved where they say, yep, that's a positive test, right? And now somehow that analog information has to be entered into the digital world, and only then you can build some diagnostics, AI and analytics on top. We remove that because ours is electronics based. Whatever testing we do, all the data is digitized, and so you remove that barrier. Because we all know for AI to work, you have to start with a large amount of data, accurate data, not data that's questionable, because we're all human beings. People make mistakes when they enter data into the system. So we're removing that process. So that futuristic view that I just gave you requires this kind of device that takes human element out, digitizes the data, collects large data. Now you can build some intelligence on top of it, right? That's really the long-term goal, at least I see, that our company and team should contribute.
And it's wild what you mentioned, no? Because it makes a lot of sense that you go to a doctor and you have to wait a lot of time for you to get a result, if it's positive, if it's negative, and then have another appointment with the doctor for him to take a decision. Like it's wild that right now there is not this machine already existing, no, and that you are actually creating it and creating it in a way that it's not only as accurate as a lab, but also it's cheap. So what are the question maybe would be like, how, and it's a question that you told me the other day, but I think it's really important, no? How is it that nobody has created this, and the ones that have created that have failed, and you bring a solution that will be the game changer?
Sure. I think as an engineer, it's also a question that I ask myself. We have obviously microbiologists and scientists and doctors on board. But personally, as an engineer, I say, how is it that it hasn't been done yet? There have been many attempts in terms of point-of-care device development. I can think of at least a couple dozen companies that made big claims. I'm sure they made sincere attempt to deliver a true point-of-care device and did not succeed yet. The way I see it as an engineer, it's more of a technology problem. All these other companies that came and wanted to address point of care, I think they were lacking in technology, the core deep tech sensor technology that we have developed. What I mean by that is, they were trying to miniaturize the way things are done today, these big machines, and they were trying to miniaturize it, but the technology that they were using underneath, the technology was missing there. So there's only so much you can do in the way these big machines are done. And these techniques, again, we're getting a little technical here. The technique of detecting a positive reaction, right? They were using colorimetry, fluorescence-based, impedance spectroscopy. These are the technologies that are already used in big machines that fill up the room, right? Trying to miniaturize that can only go so far. So that's one challenge. The follow-on to that is when you step back and say, what is a point-of-care device? It has to be easy to use. It has to be small. It has to be very low cost. And yes, it's given that it has to be lab-grade accurate, or at least approximately about as accurate as lab grades, because those numbers run into 98, 99% accuracy, specificity, etc. If you could approximate that, to me, truly, that is a true point-of-care device. And it has to be something so small, and you can just see by the sheer size of it that you could see that it's low cost, right? This is where they fail. This is where our technology is the key differentiator. The very core technology that we use allows us to miniaturize the electronics that fits into this form factor. And this technology also allows us, without adding too much cost, to multiplex. So in this cassette, we can do 96, for example, up to 16 pathogen testing. To scale from this to, say, 96 or 300, we don't add too much to the electronics cost. The size will still stay the same. And it comes from the technology. So that's where, because I come from semiconductor technology world, that is my contribution here to make sure that, and we've been developing this technology for over 4 years now. And now we're at a point where we think this is mass production ready. We have a manufacturing partner in Japan, because anytime you talk about low cost, that means you have to produce at scale. It's a numbers game, right? The more you produce, the cheaper it gets, the economy of scale. So we now feel that we have this mass manufacturable sensor technology, and we will be showcasing this at CES show next month. So this is CES 2025 in Las Vegas. We'll be with our large manufacturing partner showcasing this sensor technology and also showing our products there in terms of diagnostics. So it requires, I jokingly say within our team, that you have to have the right or good brain damage among the team players, the biochemists, the doctors, and semiconductor guy and technologists, and say, we can do this. I think where other guys failed this is one of the reasons they didn't have this group of people or this type of people and this type of sensor technology that we have developed. And it took 4 years. It was not easy.
And what is it that make you, because you're a group of passionate people from different backgrounds all together working in this company with this vision, what is it that made you think, now it's the time to do this? This is like a very futuristic thing that everyone thinks about, that you've described in the movies, but now it's the time to bring it to market and we are ready for it. What was the vision?
I think the vision is obviously, as technologists, as scientists, there is that wish to do good in society, to make a difference. But more than that, if that is not specific enough, some of us have lost friends, family members to preventable infectious diseases. I have lost a close friend. One of my best friends in high school died of undiagnosed urinary tract infection. Now I understand it to be a sepsis shock that he suffered, and within a matter of hours, all of his organs failed in high school, and died. And what I've realized is that those kind of personal tragic stories, every one of our team member can relate to that and can think of someone, friend, loved one, who went through that. So that's also another motivation for us, that this kind of pain and suffering should not exist. If it's preventable, then what's it that I can bring to the table? That's also a very common thread that runs among our team members. This is real. Just one of our marketing person, in this case a female, in her early 30s, just a few months ago had a urinary tract infection that was undetected, and she ended up in hospital and she had a sepsis shock. And good for her that intervention at the hospital came at the right time and she survived. Because sometimes these sepsis shocks, you have only a few hours to react. So it's personal. It's also a desire to make a difference. So that's why I call this people with the good right brain damage who come together and say, we want to do this. We are not going to be dissuaded by, just because it hasn't been done so far, that we shouldn't do it. We know we can do it, and we have proof now using our sensor. We have tried on E. coli, Salmonella, Legionella. We're working on a long list of other viruses. We're showcasing now that our sensor works. We can do this in this form factor. So we're very convinced that we have a solution and we're going to do it.
That's amazing. Yeah, what you say is right. I don't know the real number, but every country has tons of people that die because of preventative disease. And actually, there is a need for something like this to be in the market. My question now would be around launching this to the market, with investors. The title of this podcast is why point of care should not be a dirty word, which is something that frustrates you and that you want to change. You want to change this mindset. Why do you think that point of care, which is this kind of device that helps us, is a dirty word right now, especially for investors or other people in the community? And maybe it's based on what you've described now with different companies that have tried and still haven't succeeded, but there's always going to be one that will make a difference. So why do you think this happens, and how do you think we can change that?
Yes, again, every industry has certain, I wouldn't go as far as dirty words, but have some inhibitions, strong feelings about certain trends, certain technologies. I come from semiconductor world. There was a time when any startup company that said their go-to-market strategy is IoT. This is a long time back. It was a major turn-off for anybody to invest strategically, or from VC side as well, or corporate VC, etc. And look where IoT is today. Right? So just because it's this word is attached to a lot of failures or considered a dirty word in certain circles, doesn't mean for people like us who are passionate to just give up and not do it just because 24 companies that came before us failed doesn't mean 25th will not succeed. So I really do think that the stigma around point of care will go, and it has to go, because it has some serious implications for society, and it has real implications on people's lives. It causes a lot of point of care device could alleviate a lot of pain and suffering, I think. So for us, we believe in that, and we also now have proof. It's one thing to talk is cheap, but having a technology, having tried it, and having done our due diligence and testing, and like I said, we have done these testings in the lab. It's all in the lab, and now we're ready to go to real live samples, real life stuff. That's where, I guess, rubber meets the road, and that's where we are. And we think chances are very high that we will bring this point of care device to the market. We're going to be gradual. We're not going to go immediately into human health because there's FDA and USDA involved, etc. So our approach is very rational in that sense. Start this point of care device, roll it out to unregulated market, meaning where accuracy is expected to be lab grade, but at the same time there is no FDA or other regulatory hurdle. Applications like agriculture, food, water, do this for a few years, and then that paves the path forward for us for FDA approval, etc. So we're taking a low risk approach, and that's another message for VCs to think that point of care device does not mean human health and does not immediately mean FDA, which is a difficult road to traverse. We're de-risking our path to eventually we want to get to humans, and we want to help because we're very passionate about this, but we're also very practical that we have to succeed as a business in a unregulated environment. We categorize this under environmental monitoring, right? So whether water, food, animal and habitats, etc., that market is in itself big enough. So I invite VCs who are cynical about point of care devices to come and talk to us, and let's work together.
This is something that fascinated me when we spoke previously, which is that this device, you don't only use it in humans, but you actually could test if the meat is correct, if it has any infection, all this, and especially the use cases, for maybe hotels that do food for lots of people, or they can check infections. Where do you see the first use cases happening in this non-human environment? Where do you think that this will be first utilized, or where do you think this could grow?
Yes, I think I'm sure you read in the news all these major food recalls for safety reasons, right? Whether it's chicken, eggs, fish, whatever, salmonella related, E. coli related. Those are unregulated markets. Where food gets prepared, where food gets processed, you want to know, and they do. There is some level of testing done, and yet you end up with these big major recalls, right? Because across the entire food chain, from where animals are grown to the retail, there are many steps in between, right? Processing, packaging, transportation, how food was managed in the transportation, if they were left out in sunlight. And so you did the testing before it left the facilities, but where it reached, it was mismanaged, mishandled for XYZ reason. So clearly this screening regime is not good enough that you end up with these major costly recalls that sometimes run in billions of dollars. That's just food industry example. So having a device like this that can be lab grade accurate, and civilians and truck drivers and people who are food processing people, if you add this kind of regime to test, I think it will help to prevent these kind of expensive food recalls. Same thing for water safety. Places like schools and hospitals, Legionella and few other pathogens, they test them regularly. But again, the cost and the turnaround time is very long for them because they're using conventional diagnostics techniques, has to go to the lab and all that. So those are the areas I see in agriculture, in food, in animal husbandry. This H5N1 virus is in the news now. Those could be contained. I'm not sure about prevention completely, but at least that situation could be improved if a device like this exists with the lab grade accuracy, right? So those do not involve any FDA or anything. Those are unregulated markets. So that's where we think we're going to go first. And then eventually in 2-3 years, we're going to get to human health, a point of care device.
It's really good. And then this is connected to your mobile phone, and then the mobile phone will tell you if you are positive, negative, or whatever. Or how does the technology behind work?
Yes.
From the user.
So this reader has a Bluetooth chip inside, which a Bluetooth device connects to the phone app. Obviously, it's secure and authenticated. Basically, phone is the app, is the device that tells the end user what the results are, whether they are positive or negative. So right there and then you get the result. But beyond that, the phone app also connects to the telehealth systems, to the cloud, to be able to close the loop, right? Geolocating, all of that, phone helps us do that. Because imagine you're a farmer and you want to, you're detecting for virus in your farm. Each and every location you want to know, you want to geotag that. So phone already has that. So why complicate? That's where the engineering side comes into the picture. Why complicate things and add cost to this for functions that are already built into the phone, right? So use phone as a way so that you're not adding unnecessary cost to this, to the reader, because we want to, eventually in the long run, I want this, just like the glucose monitoring machines and blood pressure monitoring machines are under $100 retailing. That's where I want to go with this device.
And this is actually really interesting because lots of undeveloped countries that don't have AI or cannot use different lab testing sites, they all have a mobile phone. So they only need this product and then they can use it for lots of things.
Exactly.
And one of the things I was quite impressed was on also, I imagine, yes, this can do lots of things, but it will always be a little bit expensive, no? But I was surprised when you told me the price, because actually the price is quite disruptive.
Yes, I think, and it has to be, that's one of the things at least I think about when I say point of care device. Point of care device should be for the masses. So to me, that means the device has to cost at a retail less than $100, and these disposable cassettes should be few dollars, which is not achievable today. Even those big machines in the lab, they are batch processing, 100, 300 at a time. The economy of scale there still is not where cost per test would be only a few bucks, because those things don't scale. All these costs of operators, main staff, delivery, storage, people on the sample collection side in the hospital, people in the lab, and those are trained people. So that's an additional cost. So for us, we want to make sure that those costs are not part of the cost per test metric that we're measuring ourselves by, and our goal is to be single-digit dollar per test in the long run.
That's really good. And how do you see the future? Do you see these labs doing testing disappearing then in this future that we are going?
No. I think labs are going to be there. It's more of a complementary tool for them to lower the cost, increase the throughput, and also bring labs where labs cannot go, right? You can't put labs everywhere, where you're the physical real estate, trained people, etc. There is an upper limit of how many labs can you have. And that was one of the painful thing that people learned during COVID, that labs were overwhelmed because they didn't have the capacity, right? So for a point of care device like this, I see it as a complementary to how things get done. So this is more of an extension to the lab. The example I gave you of these self-help kiosks and healthcare mobile desks, for example. So you could think of those as an extension to the lab, except that they are using our device that are this small and this cheap. So I don't think labs are going to disappear. anytime soon. This is just more of a add-on complementary technology capability where labs can.
And I saw what you're mentioning about the kiosks in China, and also in California. There was a company called Forward Health. I don't know if you, but they also brought these kiosks that would complement really well with the technology. Maybe we will see this more in the future. But yeah.
Yes, I think so. We have certain companies that we're targeting to partner up with because they are building those kiosks and health centers. And I could even see this going into Costco's and Walgreens of the world and, small clinics. We're in Oakland, and when you walk into some of these federally qualified health centers, they are short-staffed. There's a lot of pain and suffering I see that could be alleviated if device like this could add more capacity to patient processing, decrease the waiting time, etc. This is where I think it will make the most impact. The healthcare inequities, unfortunately, are amplified by the way diagnostics are done today, and then follow on to that is how healthcare is distributed. So we have team members who specialize in public safety, public healthcare. There are certain engagements with entities that are work in progress, and we will be announcing those. So that's one of the moonshot goal for us, Senstek, to give back to the community and make a difference where we think there are healthcare inequities.
Yeah, I think healthcare inequalities is something you will be able to address. You've mentioned people in your company. How many people are you right now? You're growing.
Including our interns and offshore teams, we're at about 23 people right now.
Mm-hmm.
And I think we have to grow our microbiology side of things. We need to hire more microbiologists because there are thousands of different types of pathogens out there, and each one of them require microbiologists working on them, figuring out the bioassays work and capturing the accuracy of our solution versus what's the gold standard today. So for foreseeable future, we think that we're going to be using these conventional machineries and systems to orthogonally verify what we're saying, what our results are. They need to be verified against gold standard, right? And over time, we see industries, segments basically not have to replicate a gold standard because we have data and we have efficacy claims that we can stand behind. So that's where I think we'll be growing in next few years.
Really good. So I think that was all of this what I wanted to share. Is there anything else that you want to cover?
No, I think I said everything that I wanted to touch on. I think you guys now have a good idea who we are. We're going to be making certain announcements in coming weeks and months about our partnerships and some pilot programs. So all I can say is stay tuned, visit our website and learn more and get in touch with us, see how we can collaborate.
Amazing, Manny. Thank you so much, and hope you the best success because this is one of the tools that we all need. So we will be waiting to see all these announcements. Thank you so much.
Thank you, Mark. Bye-bye.